Okay, so globally, we know the numbers for type 1 diabetes in kids have been climbing, right, for decades now. It's pretty concerning.
It really is, and it's got significant implications.
Exactly. So today, for this deep dive, we're looking at a really interesting study. It gives us a very specific window into this.
Yeah, it's research from a major children's hospital up in North India. They tracked 12 years of data.
12 years.
April 2001 right through to March 2013. And they carefully went through the records of 647 children, all under 16, diagnosed with type 1 diabetes and treated at that hospital.
Wow. Okay. Over 600 kids, 12 years. That's a solid base of information. What were they hoping to find? What were the main questions?
Well, the core aim was really to map out how type 1 diabetes was changing in that specific group. Were the numbers going up?
Right.
How were kids presenting when they first got diagnosed? Was it different over time? And what were the outcomes like during that period? And this kind of detailed long-term look is super valuable, especially because getting this sort of data in India can be, well, trickier than in some other places.
Absolutely. So even if this isn't something you're directly dealing with, listeners, this is a fascinating look at how a major health issue is evolving in kids. Might give us some unexpected insights.
Definitely.
Okay, let's dive in. What's the big picture, the main trend from those 12 years?
The clearest signal, really, was this steady year-after-year rise in the total number of kids with type 1 diabetes coming to the hospital.
Not just a blip, then. A consistent climb.
Yeah, a sustained trend upwards.
How big of an increase are we talking about, roughly?
Well, the study looked at incidence relative to all hospital patients, but the bottom line is the actual number of kids with T1D treated there almost doubled over that 12-year span.
Doubled, wow.
Yeah. And that really lines up with what we've been seeing globally, this overall increase in childhood type 1 diabetes. It puts a real strain on healthcare, obviously.
For sure. So it confirms that wider trend, at least in this region. Now, more kids overall, but did they see any change in when kids were getting diagnosed, like the age?
Ah, yes. And this is where it gets, I think, particularly interesting. They found a really significant increase in the proportion of kids diagnosed very young.
Yeah.
Under 5 years old.
Under 5. That's tiny. What do the numbers show there?
Okay, so back in 2001, 2002, about 16%, maybe a little more, of the new diagnoses were in that under 5 group.
Okay.
Fast forward to the end of the study, 2012, 2013, and that figure jumped to over 35%.
Whoa, more than doubled.
Exactly. And what's really key is that this jump in the youngest kids was much more dramatic than in the older age groups. They looked at the 5 to 10s, 11 to 15s.
So something specific seems to be happening with the very little ones.
It certainly raises that question. Why are these younger children seemingly becoming more susceptible or maybe diagnosed earlier?
Right. Did the study offer any thoughts on why this might be happening, why younger diagnoses are becoming more common?
Well, it touches on the leading theories, the ones circulating globally. There's the idea of accelerated autoimmunity.
Meaning the immune attack just happens faster?
Kind of, yeah. The body's own immune system turning against the insulin-producing cells, but doing it maybe more aggressively or earlier in younger children. And then there's always the focus on early life environmental factors, things like viral infections, maybe diet, acting as triggers in kids who are already genetically predisposed. Lots of research looking into that.
It's like the fuse is being lit earlier somehow. Okay, so we have rising numbers, especially in the very young. What about how they presented at diagnosis, their initial condition?
Right. So here there's actually a bit of a potentially good news. They saw a yearly decrease in the percentage of kids showing up in diabetic ketoacidosis.
DKA.
Okay, DKA. Remind us quickly why that's a key indicator at diagnosis.
Sure. DKA is serious. It's a major complication where the body, lacking insulin, starts breaking down fat like crazy, producing ketones.
Right, and that turns the blood acidic. Exactly, it's a medical emergency. So the fact that fewer kids were presenting in DKA is positive. The rate dropped significantly from about 65% early on down to roughly 36% by the end.
That's a big drop. Suggest maybe earlier detection, more awareness?
Potentially, yes. But, and this is important.
Oh, there's a but.
There's a but. While the overall DKA rate decreased, those youngest kids, the under 5s, they were still way more likely to present with DKA.
How much more likely?
Like 2 to 3 times more likely than the oldest group in the study, the over 15s. The average yearly DKA rate for the under 5s was around 60%.
60%.
Compared to about 25% for the over 15s.
Wow. That's a huge disparity. So even with overall improvement, the littlest kids are still incredibly vulnerable at diagnosis.
Absolutely. It really highlights that vulnerability.
Why would that be? Is it just harder to spot the symptoms in babies and toddlers?
That's almost certainly a big part of it. The classic symptoms: thirst, frequent urination that can be missed or misinterpreted much more easily in very young children.
Right.
So diagnosis might be delayed until they're already quite sick with DKA. It's also possible the disease just moves faster in that age group. The study mentions increased awareness as a possible factor for the overall drop. But they also note this specific finding, the drop, wasn't actually statistically significant when they compared the first 6 years to the last 6 years.
Oh, interesting. So maybe awareness helps, but it doesn't fully explain the DKA picture, especially the age difference.
It suggests there's more going on, yeah. We need better ways to catch it early in toddlers and infants.
Definitely a key takeaway. Okay, moving on. The study apparently found something really, unexpected about when diagnoses happen during the year. Seasonality.
Yes. This was fascinating. Really, really clear seasonal pattern. They found that almost double the proportion of kids were diagnosed in the winter months.
Winter, specifically.
Yeah, December through March, roughly, compared to the average of the other 3 seasons combined.
Double. That can't be random.
Doesn't seem like it. The numbers were about 39% of diagnoses happening in those winter months versus only about 20% average for the rest of the year.
And was this just in one age group, or?
No, across all the age groups, and it was consistent throughout the 12 years. If anything, they noted it seemed even more pronounced in the second half of the study period.
That is really striking. What could possibly cause a winter peak like that?
Well, the researchers suggest this strongly points towards environmental factors, things that are more common in winter.
Like viruses, colds, flu.
Exactly. Viral infections are the prime suspect, really. They're much more common in winter, and they've long been hypothesized as potential triggers for the autoimmune process in susceptible people. Seeing this strong winter peak across all ages really adds weight to that idea.
So catching a common winter bug might, for some kids, be the final push that starts the T1D process.
That's the thinking, yeah. It highlights that complex interplay between our genes and our environment.
Fascinating and a bit worrying. Okay, let's touch on a more somber note. Did the study look at mortality rates?
It did. The overall mortality rate they recorded among these patients was 1.7%.
1.7%. And did that change over the 12 years?
Interestingly, no. They found the rate was pretty similar when comparing the first 6 years to the second 6 years.
So, despite rising incidence, younger age, shifts in DKA, the mortality rate itself seems stable during that period.
That was their finding, yes. Now, of course, we need to be careful, right? The study has limitations.
Absolutely. Always important. What are the key ones here?
Well, the big one is that it's data from just one hospital. A major one, yes, but still just one center in North India.
So it might not reflect the picture across all of North India, let alone the whole country.
Exactly. The researchers point this out themselves. Getting a true handle on incidents and trends across a vast and diverse country like India is really challenging.
Lack of national registries and things like that.
Precisely. Plus, other studies hint at variations within India, maybe differences between cities and rural areas, for example.
So this gives us a valuable, detailed piece of the puzzle, but not the whole picture.
Right. And the study itself calls for more research, larger population-based studies to really grasp the full burden and patterns of T1D in India.
Makes sense. Okay, let's try and wrap this up. If you had to summarize the absolute key takeaways from this 12-year deep dive for our listeners, what would they be?
I'd say 1, a definite rise in T1D cases at this center. 2, a significant shift towards diagnosis at a much younger age, under 5. 3, DKA at diagnosis is decreasing overall, which is good, but it's still a major risk, especially for those very young kids. And 4, that really striking winter peak in diagnoses, strongly suggesting, environmental triggers are at play here.
That seasonality is the one that really sticks with me. So much we still don't know. It leads to the question then, thinking about these trends, especially the potential environmental links. What could be done? What kind of public health actions or research might make the biggest difference here?
That's the crucial question, isn't it?
Yeah. I mean, does it point towards needing more surveillance in winter, more focus on those environmental factors, or maybe just doubling down on awareness for parents and doctors about spotting symptoms in toddlers?
All of the above, probably. Understanding those potential